everyone. My name is Tamara Shrianat, and I am a physician assistant at North Texas Diabetes and Endocrinology, working with Dr. Wasim Haq. This video is part of an informational series covering different medications for diabetes. Today, we will be talking about Trulicity, which is part of the GLP-1 agonist family of medications. Today, we will be discussing a class of medications known as GLP-1 receptor agonist. These are an incretin-based group of medications. After you eat food, the small intestine secretes GLP-1 in response to food. This hormone acts in the pancreas to stimulate insulin secretion and to suppress glucagon secretion. These two actions help to maintain a normal blood glucose. They also slow the emptying of the stomach's contents into the intestines, which helps to lower blood glucose after meals. These medications augment the actions of naturally occurring GLP-1 in the body. GLP-1 agonists are great agents for those who are overweight or obese. Overweight or obese patients generally lose, on average, about 6.5 pounds. They also have cardiovascular benefits, so they are an excellent choice for those at risk or with known heart disease. These meds are also effective at controlling blood glucose with a low risk of development of hypoglycemia. As there is some possible benefit on beta cell function, these meds are an excellent choice for those with relatively early diagnosed type 2 diabetes. How and when to take Trulicity? Generally, your healthcare provider will start the medication at the lowest dose of 0.75 milligrams once per week at any time of day. After about 6 to 12 weeks, your healthcare provider will reassess your blood glucose log and/or your hemoglobin A1C and make a decision about whether or not the dose needs to be increased to 1.5 milligrams once per week. The dose may need to be adjusted if you develop intense GI side effects, such as nausea or diarrhea.
I'll be demonstrating how to use the GLP-1 injectable medication Trulicity. This is a demonstration pen and does not have the actual medication inside, but your pen will look very similar to this. This gray cap is on here for your safety, and you can't use it unless we have removed it. This middle body section has the medication inside. This dial locks or unlocks the medication, and you can't inject unless it is set to the little green unlock setting. And this is the button that you press to inject the medication. So the first step is removing this gray cap, and my demo pen has this clear section on it, which your pen will not have. The next step is going to be unlocking the pen. So you just spin it to the unlock setting, and then you'll press it firmly on the injection site. Now, when you're actually using the medication, you will be using an injection site like your abdomen or your legs, wherever your doctor tells you to use it. I'm going to use my hand for demonstration because it's easier. So you're going to press firmly down on the medication injection site, and then you're going to press this green button at the end to inject. And when we inject, the medication will be injected through this end, and you're not going to see the needle come out, but it will come out into your injection site. So you just press firmly there, and we are going to wait for 2 clicks, and then that'll mean that it has been injected. So press the button, and there's that second click, and then you can remove it from the injection site and the pen can be thrown away.
This slide demonstrates all the locations for a Trulicity injection, including your abdomen, arms, thighs, and above the buttocks. Remember to rotate your injection sites. Storage and handling of Trulicity. Trulicity should be stored in a refrigerator. It can remain at room temp for up to 14 days. Please keep out of direct heat and light and dispose in a puncture-resistant sharps container when done. Who should not take a GLP-1 agonist? These are not good options for patients with a history of pancreatitis. These agents are also contraindicated in patients with a personal or family history of medullary thyroid cancer, which is a very uncommon type of thyroid cancer, or multiple endocrine neoplasia too. These agents are also not good for patients with severe GERD or gastroparesis, or those at risk for fluid depletion. The most common side effects of this class of medications are generally gastrointestinal, which include nausea, vomiting, diarrhea, and heartburn. Generally, GI side effects get better over time. However, if a patient reports severe abdominal pain or vomiting, we do ask that they immediately discontinue these medications, as there is a very rare risk of development of pancreatitis. When combined with some other medications, such as sulfonylureas, glipizide, glyburide, glimepiride, or insulins, there is also a risk of hypoglycemia, or low blood glucose. For injectables, there is a potential for injection site reactions. Potential advantages for the GLP-1 class of medications are numerous. One of the greatest benefits is weight loss and appetite suppression. GLP-1 medications help you feel full after a meal, which causes you to eat less. This is especially helpful in glycemic control, as weight loss is a mainstay of diabetes management. For those at risk for hypoglycemia, GLP-1 agonists act only when the blood glucose is elevated. Unless they are combined with other agents, as discussed earlier, they generally do not cause hypoglycemia. Studies have also demonstrated a cardiovascular or heart benefit of these agents. Type 2 diabetes is a progressive disease characterized by insulin resistance and a decrease in the pancreatic beta cell function. There is some data that GLP-1 agonists may help prevent further beta cell decline, which means that they may prevent progression of diabetes. Some of the most common frequently asked questions around Trulicity include travel with Trulicity. You may store your pen at room temperature for up to 14 days, which means as long as you're traveling and keeping it with you on your carry-on luggage away from direct heat and light, you should be safe to take Trulicity with you on your next trip. What if you miss a dose? If there are 3 or more days or 72 hours until your next Trulicity day, take the mixed dose. Skip the missed dose if there are less than 3 days remaining and take your next dose on your regularly scheduled Trulicity day. Do not take 2 doses of Trulicity within 3 days of each other. This slide includes a lot of detailed information. Please be sure to pause the slideshow and take a picture so that if you have any questions, you will have this as a resource. In conclusion, Trulicity can be used as a potential first or second-line agent in the management of diabetes. It is also associated with weight loss and cardiovascular or heart benefits. These are 2 very important elements in glycemic control. Please remember, this video is only intended to serve for informational purposes only. It is not to replace individualized evaluation and management. Please be sure to contact your healthcare provider to address your unique needs. Good luck, and thanks again for joining us.